Thank you guys again so much for being here. My name is Liz. I'm going to be the moderator for today. A little bit of housekeeping. We're going to be asking questions to our participants and having a really good back and forth conversation. If you have anything you'd like to add or questions that you would like to present to our panelists today, please leave a comment. Right now, we have a lot of people just leaving comments about where they're joining us from. So we'd love to hear from you. Let's keep this conversation going. Okay, before we jump into the questions, can we go ahead and get an introduction from you guys? Andrew, would you like to start?
Sure, absolutely. Thank you so much. Thanks for having me here today. Excited to be a part of what I think are these really valuable continued conversations surrounding how do we provide language access in healthcare settings. I myself am a certified healthcare interpreter between Spanish and English, and also started a language service company a little over a decade ago. So very, very excited to be here and learn from Brian and yourself and Katherine.
Excellent. Thank you so much for being here, Andrew. Brian?
Sure. My name is Brian Lezama. I am an MD and a CHI Spanish, currently residing in North Carolina. And, super excited to be here with you. I would like to call myself the newbie in the language access sphere. I've only been professionally interpreting for, I want to say, the good part of 4 years, but super stoked to learn from everybody.
Awesome. Thank you so much for being here, Brian. We're excited to hear what you have to say. And Katherine.
Hello, everyone. Thank you for joining. I'm excited to read your questions and your comments. My name is Katherine Adames, first day Spanish interpreter, specialized in healthcare, currently occupying the Director of Interpreting Operations position at Effectiff. I've been in the language access industry for over 20 years, and hearing Andrew and Brian made me feel a little old. And very passionate about language access, and I'm excited to be here with all of you today.
Awesome. Thank you guys so much for being here. It sounds like we've got a great group. Can't wait to get this conversation started. Let's dig in. So the first question that we have today's conversation is going to be very, very focused on ethics and on consent and making sure that patients understand what they're deciding, right? So what kind of processes or protocols does your team use to make sure that informed consent documents are culturally and linguistically appropriate? Now, if you guys aren't the ones specifically working on those documents, what have you seen? What do you think could be used in these different scenarios? Anybody want to jump in?
If the gentlemen are shy, I can go ahead and start. Thank you. For experience, I know that consenting to a document is a very delicate situation, and we want to make sure that the patient is understanding. Taking it back a little bit, I know that who is in charge of preparing the consent has to have a legal background and needs to understand compliance and risk management. And surely these steps are taken in the hospital or in the healthcare organization. I am not naturally part of the translations department, but I have been in many meetings and I've heard our team discuss things like this. And I know that for our organization, for example, whenever we get the opportunity to translate these consents, we explain to the client that there is a process that we follow to make sure that we provide the translation of this document, that is thorough, legal, and that the patient is able to understand. Because honestly, sometimes these documents are filled with legal vocabulary, and you're explaining it to my mother, and she's not going to culturally understand. So first, the team translates the document. There is some editing and proofreading that takes place. If they're allowed to provide their feedback as to what they consider this document should be based on the cultural ambience of the healthcare organization, they will provide their feedback. And obviously, then we go into the final review. Again, I would need to mention that maybe we would want to accommodate the document and avoid maybe high-level legal language, although we understand that some things need to remain legal for the validity, you know what I'm trying to say, for the document to be valid. And then maybe they would want to also comment on the way that the document is organized or the consent is organized. I know not necessarily for the healthcare industry, but I've seen this also in the educational side of our business, that we would want to get a better understanding of where the healthcare or educational organization is located, and culturally investigate and talk about idiomatic expressions, cultural taboos, and maybe provide this feedback to the organizations. Also, religious sensitivity is a major part of this. As an interpreter, I've seen many cases in which one thing means something to me as a Dominican, and then for an American, it means something different, and I can be offended by whatever is being said. So we want to make sure that we also share that this could be an issue. And my favorite part, obviously, involving interpreters to this communication. No matter how well translated a document is, when you involve someone that speaks this limited English proficient person's language, and we as interpreters are able to interpret thoroughly, not miss any information, and while we clarify maybe some language with the healthcare professional, we're also able to bring it down to the LEP's level of understanding of a document. And also, we serve as advocates whenever we think that this is a resource that we typically don't use on a regular basis. But if we know that a person's life is at risk and they're signing a document that they're not understanding, it is within our ethics to let the participant know. Sometimes the interpreters don't have the time to explain to the healthcare professional, because let's say it's an emergency situation and there's not much time for the back and forth. They do come back to the LSP that has contracted them and provide us with this feedback. I think that's all I'm able to provide to this question.
Thank you so much. That was very thorough. So we're going through the process of how these documents are handled for translation, right? And that is part of the process where, we're working with the consent document. It has to be translated. If it's not translated and you just put something in front of them in English, maybe they understand it, maybe they don't. Maybe they'll tell you, maybe they won't, So it's really important to make sure that we are providing those language preferences and requirements that those patients have. Ryan, Andrew, anything to add?
Sure. Well, I guess just jumping straight into it, part of the process is currently, and what seems to be like what the majority of the people are doing, is just sending off the document for translation, capturing it, sending it back to the provider, almost working like a middleman with two different entities, right? Which are our providers, our teammates, nurses, doctors, you name it, that are actually consenting our patients, as well as the translate team. And there's no real communication between those two. So speaking a little bit about our culture at Atrium Health and what we've currently been working on, and I say currently, but it's been for the past few years.
It's a process.
Yes. We, the same as the rest of the industry, we outsource our translations, but to a small woman and minority-owned company that is based here in Charlotte. And what allows us, what this allows us in comparison to having like these big vendors that just mass-produce the translations, is that we have a very close communication with their team, and we are allowed to have that almost that VIP treatment, right? Not only that, but the company also tends to be very close to our department, acting almost like another branch within our team, right? So our both our branches actually have communication. And I mean both of our branches, interpreting as well as translating, and they are part of our culture. So at the end of the day, how do we know what something is culturally or linguistically appropriate? Well, it has to do a lot with cultural sensitivity, right? What is cultural sensitivity? Just the relatability. How well can I relate myself to a person from a different culture, right? If, for example, I start speaking with a Vietnamese person, right, who lived XYZ amount of years in Vietnam, and out of the blue, I just say, oh my God, I could go for a good banh mi right now, or I can go for a good bowl of pho, right? Instant relatability. They know what I'm talking about. So that's the most important thing in cultural sensitivity, and being able to take a cold paper, right, with a lot of legal jargon and actually making it cultural sensitive or culturally appropriate is actually knowing the target audience's culture and being able to relate what we have here with what they already know, right? So being able to have our translations team so intermingled with our interpreter team, and having an interpreter also in the room consenting with our nurses and providers, I think that definitely adds a lot of that cultural appropriateness, right? And makes sure that we pick up all those little small details that are left unspoken.
Excellent. Thank you so much, Brian. That is a very solid point. That communication with your provider, with your translation provider, with your interpretation provider is so important. It should be a partnership. It should be an extension of your team. Brian, I'm just curious. This is, just for me, I'm just wondering, what type of questions might you send to your translation team or they send to you about document translations? What have you seen in the past or requested or asked in the past?
So that's the thing. We, as the middleman, try to stay as out of the equation as possible. We communicate our translations team directly to the providers that need this consent, directly to the research department that needs those consents, which are the ones that need that legal jargon so fine tuned. So the questions that we've seen a lot are mostly coming from our translations team towards the providers and not the other way around, because we're trying to tailor make these consents as best possible in an understandable fashion, right? So it's not only we're going to translate this document into Spanish for Mexicans. No, it's not like that. It's more of a general Spanish that could work appropriately in all Latin America, in Europe, for example, as well as here, in the United States. But it's more of our team reaching out to them, trying to tailor make all these documents as much as possible.
That's excellent. I think that is such an important step, making sure that everybody's on the same page, especially when you're talking about consent documents. And Andrew, anything to add?
No, just really to kind of second what Kat and Brian have already said. I think that communication piece is key. There's a couple different levels going on here, and the one is the linguistically appropriate. So observing best practices in terms of those initial written translations, both in terms of the qualifications of the folks that are doing the translation work, and also the fact that we want to make sure that there's multiple steps and kind of checks. So that could be revision, review, proofreading. We see a lot of folks kind of headed towards more and more extensive use of some of the computer capabilities, right? So with some of the machine translation and that going on, but having the checks and balances in place to make sure that the content that's coming out is in fact linguistically appropriate. But all of that, I think, Brian, you highlighted a good point of you can do a translation perfectly in terms of kind of a linguistically accurate sense, and you still have this cold document. So how are these documents getting used, and that communication with the individual providers of, what's being done? Are these documents just being handed over to patients? And we try to always train folks from the lens of, what does this encounter look like without any interpreting or language services needed? And how can we improve that, right? Because a lot of these questions are really just questions about good communication, regardless of language pairs. And so how are providers getting that consent? We've been encouraging folks that are asking for translations, do you have any summary documents that go along with this? Because an English speaker of a similar educational background is going to struggle with a 6-page medical consent that was written by the legal department to cover all their bases. That's going to be difficult to understand for anybody. And that's before we get into any sort of language barriers that are going on. So do we have any accompanying information? How is the provider handling kind of the explanation part of this and checking for understanding? All those pieces have to fit together for it to really be appropriate and provide meaningful access, right?
Yeah, absolutely.
I think that a consent form by itself is a scary document, but depending on obviously what you're consenting for. So even to us that understand English, for example, reading through all this medical terminology and consequences of this procedure or, what I'm undergoing is a bit delicate to see. So I think that also maybe the healthcare organization should have someone aside from the, nurse. I think I see the nurses being the ones that typically provide a consent and answering the questions that the patient is going to have. And with an interpreter there in the event of a limited English proficiency person being the one in need.
Yeah, absolutely. I know for me, it's much lower risk. Okay. But when your phone pops up that warning and says, hey, you need to approve of our terms and conditions, it's the same. I'm not going to read that. I'm just like, where do I sign? Done. Tell me like I'm 5. I don't know. And medical consent forms are so much more important there. If you don't have a good understanding of what you're signing, it could be detrimental. So, it's definitely, I'm like, I've had to sign those before. It's like, just tell me what it says. I don't know. So I definitely agree that making sure that that patient has maybe a patient advocate, I don't know, to help them go through the paperwork and sign. We do have a comment from Hans that said that, they worked really hard to develop a clear and concise consent form and for blood transfusion and anesthesia for the hospital system. And they've done it with a professionally translated service into the main languages that they use. So they've got a stock consent form for blood transfusion and anesthesia that has already been, reviewed and approved. I think that's a really good idea to do it once and do it right. And they require that there's a VRI interpreter to help explain the form while they review it. And they also have a witness signature section just to make sure that all the steps are followed and everyone's on the same page. So I think that's a really great idea too there, just to make sure that, there's more than one person in the room when this person is reviewing their consent form. So yeah, that is excellent, guys. We spent a bit of time on that question. I'm going to hop to the second question. And that is, do you track any indicators or outcomes to assess whether LEP patients genuinely understand what they're consenting to? If not, what metrics do you think would be valuable, right? So we're maybe not necessarily checking to the consent, but what would be a valuable metric for something like that in your experience? Anybody want to start?
I'll hop in.
Excellent. Andrew.
So from the interpreter side, one of the things that we train on really heavily with interpreters is this use of pre-sessions and post-sessions wherever possible. And oftentimes there's not a lot of time for that, right? Especially with the provider. The providers are busy, they're running from patient to patient. So we always advise that, even a very short one of when you're walking down the hall next to the provider, that may be all you're going to get as a pre-session, is that walk to the patient room. But use that time if you can. And again here, good communication looks very similar across all languages, right? So we encourage providers and try to train providers as well on how to work with folks and work with folks through an interpreter and also work with interpreters. And so some of these good communication practices are going to translate across languages and even with English speaking patients as well. So things like check for understanding, if it's you do give the rundown of your next appointments are going to be this and this is what's going to happen. do the tell back, right? The teach back of like, okay, and so when are you coming back? And what are you going to do in the meantime? And ask people to answer those questions. Because a lot of times people get in that mindset of, yes, yes, sure. Do you understand? Yep. It's easier to say yes. So
Yep.
really ask them to give that information back. And oftentimes you'll be able to identify where there's been misunderstandings. And again, that aren't necessarily the fault of interpretation or a language barrier, but just that dynamic that often exists between medical providers and patients.
I love that. Yes, absolutely. There's a thing in the deaf community called the deaf nod. In the interpretation community, where it is this, and I think we see it a lot in spoken language, where it's like, I'm so used to not really understanding, but faking it through, that I'm just gonna, yeah, yes, 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 yes. And then you get to the part where it's like, okay, we're ready to cut you open. Wait, hold on. What? Is that what we're talking about? Hold on a second. So definitely is something that happens, especially, like I said, you're so used to just not having access that you've learned that, just fake it till you make it. We all do that. Is the right way to move forward. So it's definitely something that I agree with that for sure. Anybody else? Katherine, Ryan, something to add about this?
Yeah, I think Andrew said it very nicely. And I love the part about teachbacks. Tell me what I have just explained. And if this was part of the process, that if the time is there, because sometimes there are emergency situations, but if the time is there, the fact that you can allow a patient to tell you what they understand based on what you have explained is wonderful. I think from an operation standpoint, and to assist a healthcare organization, we can provide the duration of the calls when we're discussing or talking about OPI and VRI calls. And I think hospitals do have maybe have an average of the length that a consent encounter should take. Considering that you have a language professional involved in this conversation, how much time do you think this encounter should have taken if the patient understood everything that was explained, and obviously if there was time for questions? And I guess the overall outcome of the encounter was, like you just said, Liz, the ASL person said, is that what we're talking about? So obviously the consent outcome was not positive. And so if we're able to assist operationally with those things, I think it'll be wonderful. I know that more and more hospitals now are having, as part of their processes for language access, surveys. And so if part of the survey asks a question about the consent, I guess that would also be interesting.
It's very interesting to try to track properly the outcomes, right? For all of the patients that we need. One of the ways that we have been trying to track this is not necessarily in like the common old-fashioned ways, which are, of course, your surveys, which are following the outcomes of patients, but we try to gauge it through our demand. We have the how to say this? We have the luck of having many different facilities and locations, so we have been noticing that patients that are happy, patients that feel that they're well treated and understand what's going on, what do? They pass that word on, right? So if they say, look, hey, that clinic over there, they got this magical green stick that an interpreter appears, and now I understand what's going on, right? Naturally, people are going to flow to these locations, and we try to gauge the demand of the clinics as part of the success of our programs being applied to specific locations. We've definitely seen it. Of course, it has to do a lot with population and where each of these locations are located. But at the end of the day, what we're trying to do is to reach as many people as possible, because it's already been studied time and time again how patient outcomes increase and are better with language access and language services, provided to them. So might as well just try to reach as many people as you can and just go with the flow and go where you're being asked to.
Absolutely.
I think that's super powerful, Brian, in terms of kind of trying to measure that. And it's something that we see both on the positive side and on kind of the negative side, where you'll see healthcare organizations, report that there's not necessarily a need for some of these services, or that they don't have the need to provide access because the populations aren't there. And I would argue it's very much you have to provide these services, and then the people come, and the reduction of the availability of those services. What you see is these rate kind of populations dropping off. But it's not that they're dropping off; it's just that they're either not getting the care that they need, or they're going elsewhere for the care. And so I think that's important to keep in mind.
And it's also very sad to hear, the healthcare services saying like, "Oh, there's no need for this." Well, no, there might not be a need, but still, there's a duty, right? There's a duty to treat our patients right. There's a duty to take care of our patients at the end of the day. So, of course, if you give it, they will come.
Absolutely. And that is so true with the deaf community as well. They're on the fringe, and that's one of the things where they've just had to accept no access for so long that they're just like, well, this is just my life now. I mean, I have a family friend before the ADA was enacted in the 90s. Before that, she had surgery, and this is a deaf woman, and they removed a portion of her intestines, and it required her to adjust her diet. But she didn't know. She had no idea when she woke up from the surgery that this had happened, that she needed to make these adjustments, and she got very sick because she didn't. And that's something that, that's real life, and that could still be happening in areas where services are not being provided. Huge issue, big concern, but I know the ADA has helped a lot with that. Guys,
Yes.
We have a lot of response from our attendees right now. Some are saying, that providers have very limited time to explain consent. So if the patient doesn't understand it, even if they sign it, then the patient consent it's not applicable because they didn't understand it. And we have another saying that, they try to train physicians while they're in the hospital to let them know that nod does not mean, yes, I understand, because they apparently are putting it into their log saying patient acknowledged understanding. And that is not the case. Just because they are nodding their head does not mean they understand. Anything you guys want to add or take from that comment?
I haven't been interpreting actively for many years now, but I can tell you that I remember certain encounters in which the healthcare professional would tell the LEP that they would need to speak instead of nod. This is a very important document that you are acknowledging, and I want you to say if you did or did not understand what I have explained. Sometimes they would be offended because they're not understanding that they're actually putting, they're making sure that they agree or disagree to particularly what is being said in the document. I saw Hans comment previously about the consent for anesthesia and blood transfusion. And culturally, that is one of the most delicate ones that at least that I have encountered while interpreting. Some patients, for religious reasons, do not accept blood transfusion. And when they hear that, they freak out automatically. So I think that that's one step ahead and inform that this may not happen, but we need to let you know that this can be a risk. And if you don't want to accept blood, that is totally fine. But we have to let you know that this may happen.
Absolutely. Guys, we have a question here. Do you believe the current healthcare system provides enough guidance and accountability for interpreters in high-stakes scenarios like consent for surgery or transfusion? Or is that still a gap that needs to be worked on? That's a great question.
It is. And I don't think it's the responsibility of the healthcare system to provide guidance or accountability.
Yeah.
Well, the second part, yes, maybe, to the interpreters, but for the people that are responsible, or organizations like CCHI, which the three of us belong to train interpreters and make sure that they understand all of the risks involved in this document that they're interpreting. And I think that the training has to be more thorough. I also understand that not only these organizations are responsible for that, interpreters also need to do their due diligence. They need to understand why the laws exist and what laws we're abiding by signing consent, and why these people need us to participate in these consents. And I think that we just have to, as LSPs, we also have to remind the interpreters why interpreting correctly, thoroughly, complete, not missing or adding any information is so important.
Absolutely. Anything else, Brian? Andrew?
Oh, yeah, I was just going to say that I think this also plays into, in terms of the kind of questions surrounding accountability and guidance, this is why it's also really important that healthcare systems as well as language service companies be utilizing appropriately qualified and, wherever possible, certified interpreters,
100%.
because I think that brings to the encounter a level of confidence that you may not see out of folks that are underqualified.
Yes.
And that level of confidence gives the interpreter the ability to stop, to control the encounter a little bit when there's not understanding going on. They feel a little bit more comfortable and not really challenging, but like acting in their role as an expert within the encounter of telling a provider, the interpreter thinks there's been some misunderstanding here, or the interpreter thinks that, there could be more clarification. And also kind of guide that encounter, maybe reminding providers to speak directly to patients, those sort of things, where when you see more novice interpreters or underqualified interpreters, they're going to defer so much to the person in the white coat that they're not going to interject in instances where maybe they should for meaningful communication.
That was beautiful.
Definitely agree. Yeah, absolutely.
When it comes to specifically to who is holding up maybe the interpreters, right, at that, I think that it is super important also understanding who is putting the interpreter in that room, right, and that it's also the responsibility of that leader, of that LSP, right, to make sure that all the interpreters are up to par, that the quality of their interpretation, that their interpretation skills, that their everything we learn in courses like Bridging the Gap, right? How to handle the encounter, how to be able to be that cultural ambassador and that advocate whenever needed. We need to put all that effort into making sure these interpreters are up to par before they're in the room with the patients and providers. At least for my team, I know that we have a very high bar for interpreters, and we try to keep it as high as possible. Not only through testing and outsourced testing, but we also do testing in-house, making sure that those skills are on par, so that then later we can mold them into what in our team we expect of them, right? So that's also super important, that at the end of the day, who is responsible for that interpreter to be there? It's us. It's the leaders. It's the LSPs. So
yeah, absolutely. It's definitely something very important to consider when scheduling, when working with a client. Absolutely. Is that interpreter in the right place? Anything else to add before we move to the next question? Excellent conversation so far, guys. I really appreciate you being here and loving this input. All right, the next question. In your experience, do healthcare institutions treat language access more as a legal requirement or an ethical responsibility? And how does that affect your work?
How much are we allowed to say here?
I have a lot to say too.
I was going to say, he's trying to put us on the spot.
Listen, so I think from both as an individual and interpreter and from the kind of language service company seat, I've seen all dots on this spectrum in terms of it's just a legal requirement and a box that needs to be checked, and we don't care how it actually happens, to we really, really care about the Brian, like you said, the duty, right? The duty to provide these services in a meaningful way to folks. And the effect on our work is is drastic and it's noticeable at every level. I think it's very apparent to the interpreters. It's apparent to the language service companies that are working with institutions where they fall on that spectrum. And I think it's really apparent, and it affects the patients and the patient outcomes, right? They can feel that walking in the door in terms of, is this a nuisance where, oh, now I have to call the interpreter again? Or is this a meaningful, hey, we want to provide you with the best care possible. And in order to do that, we're going to make sure that the supports are there linguistically to have that happen. So it's 100% noticeable, I think, through and through. And we see it all.
Yeah,
I definitely agree. Yeah. You can't hide. Sorry, go ahead.
No, please go ahead, Liz.
That's all.
I think that we have a lot to thank the ASL community here for. The fact that more and more organizations are understanding that there is not only a legal obligation, but that ethically and from a human standpoint, this is the right thing to do. I know that I've seen reviews and I've heard comments, and I've seen documents in which hospitals have created a language access plan because they were sued by the ASL community. And so I know that they have advocated tremendously for language access, and that before, when I started working on this, ASL was not considered as such an important part of accessibility and language per se. And so I've seen the change throughout this 20 years, but still, like Andrew was saying, we're able to feel it in all points. As a director, we're able to feel it. When I was interpreting, I was able to feel it just by the fact of me listening to the nurse or the doctor rush through the conversation, or not providing the interpreter, this patient is here for this and that, and we're going to talk about this, allowing that time for the interpreter to be ready, and also providing more information and answering adequately to the questions that the limited English proficiency person may have. And this goes back to Brian's statement earlier about outcomes, about how the patient is going to provide this feedback to their family members and friends, saying that X and X hospital provided language access for them, and that they want to go back, and that they were able to understand everything that was going on during their conversation. From a staff point of view, I know that they in their organization may feel it as well, of how important and how accountable they are to bring language access into an appointment, in the fact that instead of calling in to get an interpreter last minute, they're able to say, when they're pre-scheduling a patient, make a note or just pre-schedule also an interpreter for that encounter. How does this affect my job? And I would have to thank them for being proactive, is that I am able to allocate a resource for them with enough time. Obviously, there are other services like on-demand services in which they're able to get an interpreter in seconds if it's a commonly spoken language in the US. But then there's also languages that are more scarce in our country, and that we may need more time to find a resource. And what happens if we don't find that resource on demand? Well, that appointment has to be rescheduled, for example. And then quality, again, the quality, allowing us the time in all fronts to make sure that we're able to locate the right resource for you, that this interpreter is well trained, that this interpreter is well prepared, that we're also able to track these encounters, and we're able to have the most accurate information for you. We are currently assessing a new client, and I know that this client puts language access as part of their top priorities. Why? Because they're asking the right questions. They have a very clear understanding of what service types are. And I was so surprised to hear a client talking to me about their service type. So I think we should be getting interpreters for legal instead of social services, because we deal with this, and that. So they have a better understanding of how important our services truly are.
Yeah, absolutely. It's something to be said about those older users, more mature, that's the word that we use, mature requesters, mature clients versus we've just started, we're not really sure what we need, we don't know what to do. And those are the ones that need us to hold their hands and walk them through every bit. And just something really quick to bounce back to what Katherine was saying about the deaf community. Deaf children are actually trained throughout their entire K through 12 how to advocate for themselves and how important it is to do so, because the deaf community was not getting services, even after the ADA required it. And even today, we will have they will have doctors' offices say, yes, I have an appointment for you. No problem. You're set up. We're good to go. And then they say, oh, perfect. I need an interpreter. And they're like, oh, I'm going to have to call you back. Or they say, oh, you know what? Actually, we're not accepting new patients. So sorry, because they don't want to deal with the interpretation portion of it, and that's just a part of what they're dealing with right now. But they definitely have grown up fighting for themselves, and you can tell it definitely shows. And I think it does help the spoken language community.
100%.
Definitely. I think also we need to kind of understand like the difference between having the legal requirement and having the ethical responsibility, right? At the end of the day, the legal requirement is more of you have to have it, when having that legal responsibility is more like you should want to have it, right? Because at the end of the day, who's going to care whether you have it or not, right? Is it going to be HR? Of course not. Is it going to be finance? No. Corporate compliance? Maybe. And this goes especially for those leaders of language access departments within these healthcare institutions. All right, this goes more out for them. You are the part of the company that should care for our providers, who should care for our patients, right? You are the reason why somebody might say that company cares about me, whether it's an ASL patient, whether it's a Spanish, it's a Punjabi, whoever, right? You are that person who is hired to care for those patients. And so you are the brand of that hospital that is going to bring all of those that are either LEP, right, under that same blanket as the rest of the patients. So leaders, a lot of attention onto that.
Definitely.
And I think Brian, continuing with that theme too, I think language access, the parties kind of responsible for language access, so maybe directors of language service, is within healthcare systems, and some of those roles. Now is a great moment when we can lean on this bigger trend in healthcare, which is all about, and I saw a comment just coming through too, everything's about patient experience, right? It's all this patient experience, customer service, questions going on in healthcare. And this is a great theme that we can use to the advantage of language access, of saying you can't get a good patient experience, right, if they don't understand the encounter, if they don't understand the treatment and everything else. And so leveraging that to our advantage as a way to reinforce why people should care about meaningful access, I think is an opportune moment.
Just to add here, I think we've seen a change in this lately, and we have heard it in many meetings that we have participated. The fact that healthcare organizations are asking if we're able to link our system to theirs, integration, so that they can make this part of their EHR processes. I think it's just wonderful, and I'm hoping that it continues to happen. I'm hoping that we continue to be in conversations when it comes to funding, in conversations when it comes to ethics, in conversations when it comes to patient outcomes.
Yeah, absolutely. Any additional bits you guys would like to add to this? Number 3? Okay, perfect. We're going to go ahead and jump on to number 4. What are the biggest challenges in ensuring accurate interpretation during informed consent conversations? Example, interpreter availability, qualifications, clinician cooperation, time constraints. I do have a very specific comment I wanted to bring up. Andrew is interested in expanding the conversation on this one. This is a comment from Hans. Currently, I have a lot of pressure in my organization to start assessing bilingual staff so they're utilized as a qualified medical interpreter because of the language because of the language used in the law. The law apparently allows them the flexibility to do that. Guys, what is your experience and understanding of this tied into that bilingual staff and ensuring accurate interpretation during those informed consent conversations? Is that something that, let's just jump in. Andrew, would you like to start us off?
Sure, I'd love to, and we're seeing this in healthcare, we're seeing this in education,
Everywhere.
right? This pressure to use bilingual staff in an interpreter capacity, and in fact, I think that's how a lot of us who are in this field got into it, right? We were the bilingual staff member who got thrown ad hoc into interpreting encounters and then said, oh, wait a minute, this is a real profession and a career I can make. I know that was my kind of personal journey with some of this. So I think it can be really useful. I think the assessment is crucial. And along with that assessment, determining which types of encounters are appropriate based on their assessed skills. And then the other piece that has to go along with that is education. So education of this bilingual staff surrounding the code of ethics for interpreters, because what we've seen a lot of times is that when education is done correctly in this assessment process of, hey, these are your responsibilities and what you're going to be asked to do as an interpreter, and the code of ethics of an interpreter, which include removing yourself from encounters that you're not qualified for, what we see then is a lot of self-selection from folks of saying, hey, you know what, actually, I'm a great nurse. I'm not a good interpreter, and I shouldn't be asked to be doing these things because I know I don't have the skills. I know it's not appropriate for me. And so giving people that agency to accept or not this role that oftentimes is added in without being included in job descriptions, etc. But maybe sometimes people really are for it and they also have the skills and abilities. So assessment, yes, but also the training and informing people on what their responsibility would be if they're assessed at an appropriate level.
Absolutely.
I would definitely
Brian?
love to just jump. Oh, I'm sorry, Liz. I would just definitely love to jump in because this is one of the subjects of which I get a lot of questions from within Atrium Health,
I'm sure.
and that a lot of it has to do with how people don't really understand what an interpreter does, right? At the end of the day, we as interpreters know that medical interpreting is not a skill set that any Joe Schmo on the street might know, right? It's a practice profession. It requires testing, it requires training, it requires not only that skill, but also knowledge and cultural sensitivity, right? We also know that Joint Commission standards, it sets specific qualifications, right, for language testing, education, training, as well as experience for interpreters. But I think that it has to do a lot with people just not being in the know of what an interpreter is, what they do actually, right? I might be great at speaking another language. That doesn't mean I'm a great conduit for it, or it doesn't mean that I understand what's going on in both languages, right? How many of us that are bilingual are actually able to think in both languages? For example, I've had that comment thrown at me a couple of times. So at least at Atrium Health, we've definitely pushed towards that separation of qualified bilingual teammates and interpreters to the point that now, and I say now for the past, I want to say 7 to 8 years, we have a properly under patients' rights policy, right? If you're a qualified bilingual teammate, right, you came to us, we gave you the test, you passed it, excellent. Go ahead and do your duties in whatever language you're approved to speak. But if you are not if you are a qualified bilingual teammate, you can't interpret it. You haven't been tested for it. So I'm sorry, it's just not appropriate. It's not the proper way of doing things.
Absolutely. Katherine, I know you've got something to add.
Yeah, I just, I think sometimes healthcare organizations may use the fact that someone is bilingual as an escape. And sometimes they would see this as part of saving money for their organization. And like these two gentlemen have said, not because you speak another language, you're able to interpret. There is a lot that involves interpreting. And there are many things that you need to know besides vocabulary. And so it's a very thin line. And also, I think it's important, like Andrew said, that you clear out these person's job description. So are you going to call me out to interpret for you at all times? Does this mean that I will not be an interpreter, or should I continue being a nurse? I think a very fine line here. If they're able to train their staff, I think we had an organization ask us before if we provided training for interpreting and that they could, give their staff or use for their staff. And we didn't at the moment. If you're going through the right processes to train and evaluate and qualify your people, why not? But, to those staff members that are being qualified and trained, be careful as to what you're going into.
Yeah, absolutely. It's definitely important as a bilingual staff member to know that you can say no. Just like what Andrew said, it's very important to be able to say sorry, especially in this situation that we're talking about, where we're talking about consent. That is a little bit above what I'm able to do. You need to get someone in there that can do this correctly, because it is high stakes. And they, in hospital settings, they sign those every single day. They're getting people to sign them. It's business as usual, right? But for that individual, it is a very intense and serious form that they're signing. And they need to know it's not just like, oh, okay, let's go. You're not renewing the terms and service here on your iPhone. This is real, serious life and death type of consent. So I definitely agree that, being able to back out as an interpreter or as a bilingual staff is really important. I'm not sure that we actually fully addressed the actual question, because we jumped into the bilingual staff question. So anybody have anything to add about ensuring accurate interpretation during informed consent conversations?
I just need to say, and I know the gentleman would probably add more to this, make sure that as an LSP, I need to make sure that I'm providing you with the right interpreter who is trained in these encounters, who has the right vocabulary that they need to use, that they're very well qualified, and understanding if the healthcare organization needs or doesn't need a qualified interpreter for that. Sometimes we've heard feedback from interpreters that they would say, you said that we didn't need to be certified or qualified for this encounter. But actually, when we were there, the client said that certification was needed. So I guess making sure that we clarify and that we send the right resource so that the interpretation encounter can be positive.
Yes, absolutely. I know that Brian was having a little bit of technical difficulty on his end, so hopefully he'll jump back in. But in the meantime, Andrew, anything you wanted to add about accurate interpretation for consent?
Yeah, I think the challenges we see, most of them can kind of be categorized into two bigger themes, which is time and attention, right? So time, because the providers maybe don't have time, they're rushing to the next one. And attention, again, just being intentional and making sure that the attention being paid, the appropriate attention is being paid to the encounter and to the patients. So, we see this a lot as far as like providers don't have time, but we are seeing creative solutions with healthcare systems where maybe there's a patient advocate or somebody else who I understand, has a lower kind of dollar value cost to the healthcare system that can have a little bit more time and spend that extra amount of time going over the consent with the patient and saying, this is what you can expect, and making sure that they understand, and then do that through the interpreter. So yeah.
Definitely. I definitely agree with that. I feel like that would, having someone to be able to have that conversation and to prepare the patients prior to someone coming in and getting the official signature is an excellent idea. Excellent. I love that. Brian, welcome back.
Yes. Sorry about that.
No worries. No
Spectrum
worries.
loves
We're
me.
glad.
What
We're
can I
glad
say?
you got it sorted. Did you have anything to add to the informed consent conversation?
Well, yes, and this goes a lot of to that question that is, what are the biggest challenges ensuring the accurate interpretation? I think a lot of um, the okay, our biggest challenge is just cutting that middleman, streamlining your workflows within either your LSP or your healthcare system, being able to have easy access for our providers. That is the most important thing and the biggest hurdle that we have to jump on. How do we actually get into those patient exam rooms, right? And again, it comes a lot onto the leader uh, be, being willing to go back into the old days where you go onto the floor of the hospital with your business cards and say like, hey, we're here, let us know, right? We're with you. Just going over that mental hurdle of having to go maybe back onto the old ways, getting providers on our side, taking them out for lunch one day, or just showing up with lunch. They'll definitely appreciate that, and they'll be more willing to help out with you.
I think as LSPs, one of our biggest responsibility is to make sure that the services we provide are easy to access. And we see that now with these conversations about integration. This, going back to what you were saying, Brian, how do we get into those rooms and make sure that access is there? Integration and making sure that we communicate adequately to the staff that these services are available. I've seen posters, and we use posters as well as an organization, and make sure that information is able and available for your staff. And it should be included in the onboarding process, that Andrew knows that part of their work is to make sure that Katherine, who speaks Spanish, is able to get interpreting services for her consent, and to make sure that this goes into their workflow. As Brian was saying, that when Liz sees that Katherine is coming to the hospital, she needs an interpreter, call or send an email to whichever LSP you're using to schedule that interpreter for her. Easy. Or that they have the 1-800 number to call, and that they know that one is for Spanish, that they have a PIN number, or that their number is whitelisted, that they're able to get through to that interpreting service as quickly as possible.
Absolutely. Anything else to add, guys? Awesome. Looks like we have one more question, but we are out of time. Does anyone have a hard stop at 2?
I don't.
Andrew, Brian? No? Well, let's see how far we can get in this last question. Is your team involved in reviewing or improving consent forms, scripts, or materials to ensure they're understandable and culturally sensitive? How does that process work? Anyone?
We wish we were involved. From the independent language service company, we wish that we could be involved in that process and make suggestions on that. And oftentimes that's not the case. Those documents are getting issued and drafted without a lot of concern of what does this look like when it gets converted into another language, because it has to meet all the kind of legal boxes, and that's the primary concern. So we'd love to be more involved in that process. Brian, I'd love to hear about y'all's work, because it sounds like you said, there's a lot of integration there, and so maybe more along with the ideal from our side.
When it comes properly to the translations team, there is, right? Whenever there is any, but formally in the producing of these documents from scratch, sadly, no. These documents kind of just appear on your SharePoint site out of the ether, right? Nobody actually knows who writes them or if they're actually alive. So, I mean, sadly, no, we're not involved in that process. We would definitely love to. That would definitely be, great, but no.
I think we can add value informally. Maybe we can alert whenever we see a form that is confusing people. We're not directly advocating to one person when it comes to our ethics and all that stuff, but we're saying, okay, this document is confusing for your patients, and when we're interpreting, we have to clarify 100 times so that they understand. We can add value there maybe, but as the gentlemen have said, we're not at all involved into preparing this consent form scripts or materials.
All right. Well, sorry, we're hands off in that respect, guys. That is definitely something that the legal team most likely handles, right?
Well, and I think it's a missed opportunity in a lot of cases, because I think the healthcare organizations, be it their in-house team or a third-party vendor, they have these connections already with experts in this area, and I think, you know, what we're consistently advocating for at an industry level is to incorporate us into the planning stage, into those more initial stages. Is you got to think about language access, and you got to think about language services from square one. So, you know, get the language access person in the room. Brian, like you said, the mysterious room where these documents are being drafted, like we need a seat at that table as well from the language access side. And I think that could be really helpful, and I think it's a missed opportunity because a lot of times the connections are there, the resources are there in terms of the professional expertise, but we're not getting consulted necessarily at stage one.
Absolutely. And I'm sure there's a bit of a misunderstanding as well when you take a document and you translate it to Spanish. It's not going to be exactly the same. Like it's not. It doesn't work that way. So there will be things that would be better adjusted a little bit. And the same is true for every language. It's not just cookie cutter. So,
right.
yeah,
And that's
definitely.
before we even get to, you know, right to left languages and other differences there, and formatting and
absolutely. Absolutely. I think we're circling back to what was that question 2, where it's like teamwork, communication, let's work together here. We all have the same interests. We want the patient to know what's going on. So awesome. Well, thank you guys. Before I go, anything else that you guys would like to add before we wrap this up?
I think just to finish it off, if we're able to, you know, maybe push those mystic entities, that living nothingness, into working a little bit more with us while they're, you know, drafting these documents. I think at the end of the day, the best way to, you know, get close to them is just asking the question. So what are we eating? What are we going to eat? Let's go eat. You know, everybody loves that. And just coming back to that relatability, right? Let's sit at the table. Let's part bread and let's get to it.
Absolutely. Love that. Thank you guys so much for joining the conversation today. I really appreciate having you here. It's been excellent bouncing ideas and sharing understandings with all of these things involving decision-making and ethical interpretation. So thank you guys so much for being here. And thank you to our attendees for joining and for participating through the chat. We really enjoyed seeing your comments and talking about your questions.
Thank you for having me.
Join us again next month, guys. We do this every month. Thank you.
All right.
Bye,
Have a good
everyone.
one.
Thank you.